Time now for our Doctor is In segment. This morning we are talking about hormones. They have an impact on everything in our body, from blood sugar to blood pressure, growth and fertility, sex drive, metabolism, weight, even sleep.
And yeah, different hormones affect our body differently, mentally, physically, you name it, both in a positive and negative way. And the influence of hormones can actually change the way that we think and act in our daily life.
Joining us now is triple board certified internist, Dr. Sue Decotiis. She specializes, among other things, weight loss and hormone replacement therapy at her medical center here in the city, as well as NYU Langone. Doctor, great to have you with us this morning. So if hormones are the chemical messengers in our bodies, so can we control the message at all or no?
Sometimes we can. It depends on what's going on. But there are a lot of missing parts here, correct?
Yeah.
You know, so all of these hormones have to communicate. Think of a symphony, right? You have to have the brass, the percussion, the woodwind. So when everything is turned on, it's great. When something goes awry, it's not. And in my practice, most people come in actually with, they may not necessarily think they have a hormonal problem, but they just don't feel well and they don't know what's going on. Maybe they gained 5 or 10 pounds and they can't take it off and they don't know. And for them, that's very abnormal. Or someone might have a massive weight gain. So this really has to be looked at carefully. And, you know, we have many different types of hormones in the body. You know, some are the sex hormones like estrogen, progesterone, testosterone. Obviously, you've heard of premenopause, perimenopause, when women's hormones go down. With men, it's low T. And this can cause a lot of problems, but just about everybody that comes in has an issue with insulin.
And you mentioned estrogen. Let's start there, because not only can this just affect the way that we feel, but if your hormones are not in balance, estrogen is one example, this can actually lead to serious disease.
Yes, it can. I mean, estrogen keeps the body young. It prevents osteoporosis, mental decline. It's good for your heart. I mean, there's been some controversy about hormones. I think a lot of it is because it wasn't studied well. But estrogen can start dipping down in your 40s and your 50s. But I think the first hormone that goes down in premenopause is progesterone. And when that happens, a woman can start getting really bad PMS, a lot of bloating, trouble sleeping. And this can happen maybe 10, 15 years before real menopause.
Let's talk about testosterone. We hear a lot about that, especially some of the guys who might be watching this morning. What do we need to know about that?
Well, it's more than just a sex hormone, okay? It really helps guys with focus, with mood, with being able to build good muscles. I don't mean to bulk up, but just to get a good workout at the gym, mental health, attitude, all of that, and of course sleep.
All of the hormones are important, but one that you specifically said we need to talk about is insulin.
Without a doubt. You know, insulin is really a very interesting structure, and there are many peptide hormones in the body. So a lot of the signaling hormones are peptide hormones. And what's so fascinating is now we have this new category of medications, such as Ozempic, Semaglutide, Wegovy, Rybelsus, and now we have the newer drug, Mounjaro, which is Tirzepatide, which is even better at burning fat. These are peptide hormones, actually. These are actually peptide drugs that work in the body. So they're copacetic with the body. And I believe that's why they've been so successful with helping people lose weight.
Before we move on from that, you know, you mentioned Ozempic. We see that all over the place now, all the celebrities using it, whether they're admitting it or not, and people debating whether or not something like that is safe. What is your opinion on that?
My feeling in general is that they're pretty safe because they're peptides. So they're not this big whopping medication that your body has to break down. They really work well with the body. So I really feel comfortable that we're going to have a great safety profile with them as time goes on. And the whole category of drug has been around for over 10 years. We just had some of the earlier iterations that weren't that powerful, and now they're getting better and better.
Let's talk about thyroid hormones, and we hear a lot about this too. And a lot of times when you have some sort of problem, the first thing they question is a thyroid issue.
Yes. So thyroid works on its own, but it also is affected by everything else. So this is the irony. A lot of people say, oh, give me some thyroid hormone, I can lose weight. I'll say, well, let's lose weight and then your thyroid's going to work better. So it's amazing how all of these hormones affect each other.
Stress hormones too.
Yes.
A major impact on your entire body.
Absolutely. And cortisol can be in excess, can be a very degenerative hormone. It really breaks your bones down, gives you a lot of mood issues, muscle weakness. And as we get older, cortisol goes up. So elderly people have higher baseline levels. When you replace estrogen, progesterone, testosterone, and you balance insulin, let's say by losing weight, going on one of these medications that we mentioned, like Tirzepatide, what can happen then is that cortisol is balanced. So think of two partners on a seesaw, insulin and cortisol. You know, so they kind of balance each other.
Finally, in our few moments that we have left here, it may be difficult to generalize, but how do you know whether or not, when is it time to go to see a hormone specialist?
Well, if you're having trouble losing weight, and no matter what you do, you can't lose it, give yourself a couple of months of diet and exercise. If your hair is thinning, if you feel cold, if you're having trouble with sexuality, if you're having trouble with sleep, if you really just don't feel like yourself, something's awry. Even if you go to your regular doctor and he says everything's okay, it's good to get that checked.
And usually you know your body, right? We hear that a lot too. You know your own body when something's not right.
And also what I do in my practice is follow patients with a body composition scale. So you and I could be the same weight and height, and one of us could have a lot more body fat than the other. So realize following body composition is something I do for everyone, even if they're not overweight and they come in just for a hormone evaluation.
The moral of the story always seems to be, no matter what health segment we do here, trust yourself and trust that you know what's going on in your body. Dr. Till, good to have you here. Thank you.
Thank you so much.